Health Minister Moses Baptiste emphasized the government's dedication to ensuring that all citizens, especially the underserved, receive quality health care. The minister, who unfurled the UHC roadmap, addressed the challenges faced by the healthcare system, particularly during the COVID-19 pandemic, and highlighted the current PA administration's proactive measures to address these issues inherited from the previous pandemic-era UWP executive.
In an environment where the health system was already struggling, Mr. Speaker, it was further compromised by COVID-19. And this Prime Minister took action. He took action to increase the health budget from $183.1 million in 2020-2021 to $206,073,800 in the 2025-2026 budget, the largest ever in the history of Saint Lucia, Mr. Speaker. This Prime Minister increased the Millennium Heights Medical Complex budget. Most people refer to it as the Owen King EU Hospital. This Prime Minister increased the Millennium Heights Medical Complex budget from $31,647,939 in 2020-2021 to $70,561,888 in 2025-2026.
Baptiste expounded on plans for the new universal health coverage model, which aims to consolidate public and private healthcare financing into a single system, ensuring equitable access to quality healthcare for all citizens. He criticized the previous UWP administration's rhetoric on health insurance.
To achieve this transformation, Mr. Speaker, the universal health coverage will be financed through a public-private partnership. It will not be fully funded by the government, or it will not be a fully nationalized system. You hear on the other side, again, all they're bandying about is that they had health insurance to give every single St. Lucian. We have not heard the explanation, Mr. Speaker, so I cannot compare what we are doing with what they think they said they would have, could have, should have, and will try to would have done. It's a lot of bluff, Mr. Speaker, a lot of bluff. So we are explaining to you what we have explained to the people of St. Lucia. We will emphasize information and data sharing across public and private sector providers. So right now, the private sector is working in silos, in its own system, the private doctors and the pharmacies and so on. The public sector is working in its own silo, and there is no cross-fertilization. They're not working together. What we want to do is to have an integrated system which is based on information.
The government is working to expand services to include diagnostics for cancer and kidney care, as well as treatment for chronic obstructive pulmonary disease, COPD, and snake bites.
The proposed benefit plan will be structured into 3 tiers, Mr. Speaker. The first one will be government funded, providing essential healthcare services to most of the population with a focus on primary and secondary care, the essential package of health services. So, for example, cancer screening, dental services, eye care services, mental health services, nephrology, meaning kidney care services, and so on, breast cancer and that kind of thing. The second tier will involve a mix of private insurance employer contributions, government support, catering to individuals and families who can afford additional coverage. So there's a certain level that the government will cover. There's another level that if you want additional coverage, you can also participate in. And the third tier provides for complex and catastrophic healthcare needs, including overseas care when necessary. This will be supported by reinsurance mechanisms. It's important to understand, Mr. Speaker, that this stratified pool risk coverage model, it consolidates public and private healthcare financing into one system.
Minister Baptiste's address underscored the government's commitment to healthcare reform and the importance of collaboration among all stakeholders.
There will be a universal health coverage authority, and the key features of that, Mr. Speaker, will be the elimination of upfront payments and the reduction of out-of-pocket spending. Remember, 37% of our healthcare costs comes out of pocket. You have to pay for it out of your pocket. We are going to establish a framework that ensures that even tourists can contribute to the healthcare funding. It must be supported by an integrated digital system and, of course, comprehensive legislation. As I said before, we are going to establish the Universal Healthcare Authority. And we are discussing with the NIC and other organizations whether it should be an independent authority, housing the National Insurance Corporation, or embedded in the NIC and phased off for a while. These are being discussed. Each of these options have their own trade-offs and benefits. In other words, Mr. Speaker, we are creating a framework, and we are not thinking about creating it, we are actively creating a framework which will allow us to fund and finance sustainably the Universal Healthcare Program.
Groundwork for the current Universal Health Coverage UHC system was established 20 years ago during Dr. Kenny Anthony's administration. This included a pilot program with the National Insurance Corporation to provide free medication for chronic conditions such as diabetes and hypertension. Discussions about the national health system, however, date back to the United Workers' Party's administration of the 1980s. Joachim Duplessis, HTS News Force.